Good morning, good afternoon, good evening. We know that long COVID or post-COVID-19 condition is common, and millions of people are affected after their initial COVID-19 illness. A teacher who has given up her job because of memory problems and difficulty focusing. A sports person who is bedbound months after COVID-19 infection due to dizziness, shortness of breath, and palpitations. A nurse who worked on the wards during the pandemic, had COVID-19 and now struggles to find an explanation for episodes of blackout. An active mom who feels unable to care for her kids on many days due to severe tiredness following COVID-19. Many people feel this way. More importantly, they might not feel heard or understood by their families, employers, or healthcare providers. Long COVID is a global problem. Global estimates vary, but some suggest 6 in 100 people with symptomatic COVID-19 infection develop post-COVID-19 condition. Of these, about 15% of patients continue to have symptoms at 12 months. It is becoming clear that the chances of having long COVID after initial infection is reducing over time. Vaccination protects from severe COVID-19 and reduces the risk of long COVID. Despite this, SARS-CoV-2 continues to circulate, and there will still be a substantial burden of long COVID in the years to come. You know the common symptoms, and that symptoms can be so variable, ranging from mild to severely debilitating. They can affect everything: exercise, work, and perform daily activities. So early and accurate diagnosis is important. Scientists looking at the underlying causes have seen many different abnormalities. These include microscopic blood clots, altered immune cell responses, changes in the microbiome, and abnormalities in the nervous system. Our increasing understanding of the underlying mechanisms of long COVID is good news. This will help to develop tests which can be used for diagnosis and to monitor treatments. As part of WHO's work around global standards, we developed a clinical case definition of post-COVID-19 condition, which allows recognition of the condition in clinical practice and is used as a standard for research studies. I am optimistic about science delivering treatments which are urgently needed. Antivirals, anti-inflammatory or immunomodulators, cardiac agents, anticoagulants, and other treatments are being studied. We encourage you to get involved in clinical trials where possible and where offered. Most of all, we need to deliver high-quality care and support for people with long COVID. At the heart of WHO's ambition for all health systems is an accessible, close-to-home, and well-integrated model of care, or universal health coverage. Some patients may already have access to additional specialties and rehabilitation therapies, but access to these services is patchy, both within countries and globally. We want care that is evidence-based, person-centered, and accessible to all. What are we at WHO doing to help this happen? We are developing clinical practice guidelines for the management of people with post-COVID-19 condition based on new evidence generated by the international medical research community and first responders. The guideline development group is made up of global experts, frontline providers, and patient partners. Apart from regular meetings with researchers, we also support a monthly global educational webinar series to update healthcare workers and give guidance for practice in the face of clinical uncertainties. We work through our regional offices to understand concerns and priorities of people with long COVID through our community engagement officers, which helps us to deliver accurate and relevant updates and information. Since August 2020, we have listened to and spoken directly with long COVID patient groups and have been working together to find solutions for those suffering from long COVID. WHO remains committed to learning more about the medium and long-term consequences for people with post-COVID-19 condition, and most importantly, delivering both treatments and knowledge which help people's lives. The scale of our work needs advocacy, strong partnerships, and robust healthcare system. This meeting is an important part, and I wish you all well for it. Thank you.